sir. My name is again. My student number 2201421043. Now, I will talk about an article named Medical Exploitation of Black People in America Goes Far Beyond the Cells Stolen from Handwritten Legs That Produce Modern-Day Miracles. In the article, there are several examples of racism occurring in a medical context against black people in America. The first one is medical exploitation of handwritten legs. Lex is a black woman, unfairly and without her consent, had samples of cancer cells taken by Johns Hopkins Hospital in 1951. The cells, known as HeLa cells, have been used in various medical research without consent or compensation to Lex or her family. The second one is Tuskegee experiment. In 1932 to 1972, the American federal government conducted the Tuskegee experiment involving approximately 600 black men who were lured into treatment for syphilis but were not given proper treatment. This experiment lasted for 40 years and demonstrated the systemic medical abuse of the black community. The third one is grave robbing in black communities. In the 18th and 19th centuries, the practice of grave robbing in black communities occurred, in which the body of deceased black people were stolen for use in medical dissection. Next is medical experiment on prisoners. Dr. Albert Klippman conducted dangerous experiments on inmates, most of whom were black, in Philadelphia from the 1950s to the 1970s, and these practices demonstrate systemic injustice in the delivery of medical care and unethical treatment of black communities. The last one is forced sterilization of black women between 1909 and 1979. The thousands of women, is most of them black women, were forcibly sterilized in California and North Carolina. These practices demonstrate the biological control and operation of black women's bodies, as well as systemic inequities in the healthcare system. So now, I want to highlight the cause, the implication, and my recommendation to eradicate racism in America toward black Americans based on the articles. The first one is causes of racism. The first causes is history of oppression. Racism against black people in America has deep roots in a history of oppression and exploitation. Harmful medical practices such as the Tuskegee experiments, grave robbing in black communities, and unethical medical experiment on prisoners demonstrate a systemic pattern of abuse and discrimination against black people in the healthcare field. The second one is systemic injustice. The American medical system is still influenced by negative racial views and prejudice against black patients. There is a tendency to provide inadequate attention and health services to black patients, as well as unequal access to quality medical care. Next is incorrect biological perceptions. Some medical practitioners still believe in biological differences between black and white patients, resulting in unequal treatment of black patients, such as reduced prescription of painkillers or slower treatment of their medical complaints. Next is the implication of racism. The first one is poor health. Medical racism contributes to significant health inequities between blacks and whites in America. Black people tend to experience higher rates of death from a variety of diseases, including chronic disease and cancer, and have shorter life expectancies. The second one is distrust of the medical system. The long history of medical abuse of black people has created a high level of distrust of the medical system among the black community. This can hinder their access to timely and quality care, as they may be reluctant to seek medical help for fear of discrimination or abuse. So, my recommendation for eradicating racism, especially in America, is the first one is education and awareness. It's important to raise awareness about the history of medical abuse of black people in America, both among medical practitioners and the general public. Better education about medical racism can help reduce prejudice and provide more equitable and empathetic care. Next is anti-racism policies. Government and health institutions should implement policies that specifically target the elimination of medical racism. This can include culturally sensitive employee training, monitoring unfair medical practices, and promoting equal access to healthcare for all people. Next is community participation. It is important to involve the black community in decisions regarding their healthcare. Involving them in the design of health programs and medical research can help ensure that their needs and concerns are properly considered. With these steps, the hope is that we can create a more equitable and inclusive health system in America that respects and meets the needs of all people regardless of the color of their skin. Now, I will talk about racism of black Americans during the modern. The following that I will talk about is several examples of racism that occur against black people in America and still occurs today. The first one is systemic discrimination. Black people often face systemic discrimination in many areas of life, including law, education, employment, housing, and health. Next is police violence. Cases of police violence against black people, such as unjust shootings and unwarranted arrests, have sparked protests and movements such as the Black Lives Matter movement. Police violence against black people is often a symbol of the racial injustice that still exists in the United States. The third one is redlining. The practice of redlining, which is the denial of loans or insurance to a community based on race or ethnicity, has led to housing segregation that impacts access to adequate housing and economic opportunities for black people. Next is, of course, the health disparities. Health disparities still often happen to black people. Black people still often experience significant health disparities, including higher rates of death from certain diseases such as diabetes, hypertension, and COVID-19. Factors such as limited access to high-quality healthcare, economic inequality, and racial stress may contribute to these disparities. Next is educational discrimination. Despite the passage of laws prohibiting racial segregation in school, there were still inequities in education between black and white students. Factors such as lack of resources, inequitable funding, and negative stereotypes can impact the quality of educational black students receive. The sixth one is stereotypes and prejudice. Negative stereotypes about black people still exist in American culture. But in the media and in everyday interaction, these stereotypes can influence societal perception and lead to unequal treatment of black individuals or communities. Next is the suffrage struggle. The voting rights of black peoples have been the subject of a long struggle in the United States, with efforts to suppress their participation in the electoral process through restriction on voting rights and other discriminatory practices. Racism against black people in the United States is a complex problem that continues to affect the life of millions of people. Although there has been progress in the fight against racism, much work remains to be done to achieve a truly inclusive and just society for all citizens. That's all from me. Thank you.